From smart implants that monitor patients in real time, to 3D bioprinting of tissues, to next-gen medical devices that are reshaping surgery and recovery. This is where technology is taking healthcare. To unpack it all, may I invite Toya Singh to the stage, and joining her for the discussion are Dr. Ameya Velinkar, joint replacement and orthopedic surgeon, Bone and Joint Care, Goa.
You to talk a little bit about the philosophical problems that come with AI. And we're going to delve a little deeper to robotics and the philosophical problems that come with that too. So Dr. Meya, let's start with you. Yeah. You have been a pioneer of AR, so augmented reality, and robotics in the last few years. And before we go ahead and ask you deeper questions, if you could just tell our audience a little bit about what pioneering robotics has actually looked like. So what I want to understand is, what are some of the questions patients have? That basic trust where they're like, we want Dr. Meya, we don't want that robotics equipment doing anything. Does that still happen to you? Has anything changed?
I started doing robotics from the last year. And today in my practice, that do you want a robotic or you want me to do it? Most of the patients is, sir, do what is best in your hands.
Okay.
As far as AI, I was hearing to the many other talks also, the surgeon's sharpest tool is his presence of mind. It is not AI, it is not robotics. Third thing is, understand the robotics into joint replacement. It's a machine which can mill a bone for a precise implant to be fitted on it. We should not get confused to humanoid robots. The robots don't give an incision, they don't dissect a soft tissue, they don't cause any decrease in the bleeding, it only mills the bone for that particular company's implant to fit their best. If I look at it 1 year down the line using robotic, I'm not buying a robo, I am selling myself to the company who has made the robo, because once I buy a huge investment robo, I'm supposed to do it for the next 5 years to recover the cost. So, like Wallis will make a perfect robo to fit a Johnson & Johnson knee. Rosa will do it for a Zimmer. And there are Mako comes with Stryker. So each company has come out with a robo. In the other word, they have come with a milling device which will make the bone fit their implants perfectly. Robo does not do cementing. See, mind you, the longevity of the implant depends on the cementing. The interface between the implant and the bone is by a cement mantle. Cementing is still done by the surgeon, by his usual skills. Alignment can be helped with a robo, but we are in India, a country where cost and finances is a big constraint. If you want to get healthcare to rural areas, build a stronger India, not so small state like Goa. So if you're looking at healthcare to a general public, it is AR, that's augmented reality.
So explain to us very quickly before we go ahead and before we go over to Dr. Shekhar. We all know what augmented reality is as a concept, but here, what's the application?
So in a joint replacement, augmented reality is just like your Vision Pro goggles, or it is Microsoft has come with also a tool, or which I use is Pixie, it's a French company. Basically by wearing the goggle, I can come to know the mechanical axis. So when I'm doing a knee replacement, I know where the center of rotation of the hip is, I know where the center of rotation of the ankle is. So I am able to precisely put the knee in the mechanical axis of the leg in all its angles. Okay, so that is what improves implant longevity. Okay, now second thing is, what is being sold about robotics is it's a perfect alignment. Our god of joint replacement, Sir Insal, or Chit Ranawat, who operated our ex-Prime Minister Vajpayee, always said 1 to 2 degrees of malalignment of the implants does not decrease the longevity of the implant. So we are trying to buy an equipment, trying to be 1 or 2 degrees to prevent this 1 or 2 degrees. However, mind you, robo cannot see a leg. Robo can only see the electrodes of the stylus. and it tells you, mark the medial malleolus, I mark it. Mark the tibial tuberosity. There is no specification of which part of medial malleolus, the most anterior part or the most posterior part, not been specified. Now, when the landmarks which you're marking is not specified, how can you expect the robo to give a perfect image? When we see the traditional jigs made by Insal and Ranawat to be within 1% of the outliers, now we are saying robotic has to be perfect when a robo cannot see it.
Let me go over to Dr. Maya to ask exactly this, or a version of this rather. When it comes to your actual implementation, so we've talked a little bit about robotics and how you are pioneering it, but I want to understand when you're either talking about people going to a different hospital or you're talking to patients and you're trying to tell them that this is something you should use, this is something you should trust. What are the issues you're still coming by again and again in implementation beyond cost? Because you talked about expensive machines as problem number one.
See, first of all, whenever like in our orthopedic implants, we are not talking about robots like Da Vinci's robots, which are open robots, which can do any surgery as you program it, which is controlled by the surgeon.
Very controlled, yeah.
Within the console. That's a different level of robotics. We are talking about robotics in joint replacement are just milling devices, which will make an implant fit better. Now, it's all the patient's choice. Now, when I ask my patient, some patient will have a perception, sir, I want Johnson & Johnson. Some will say, no, sir, I want Smith & Nephew. Now, if I have a robo of a particular company, I have no options. My robo is Johnson. It will fit a Johnson. That's it. Okay. Now, cutting of the bone in a joint replacement roughly takes around 8 to 10 minutes. Now, this cutting part of the TKR is spread over 20-30 minutes by a robo to analyze the bone, everything, and start cutting. Okay. So, now, especially augmented reality, I go with those goggles in any hospital. What will only do. So, in fact, I'm making a surgeon more handicapped by using a robo. I would go by the traditional cuts. I would, in certain cases where there is an implant in the femur or there is a plate above, where my traditional jigs will not work, I will use AR, augmented reality. Okay. For that, we need to work on the cheaper medical this without compromising the patient's safety. AR, I've been using it now for the last 6 months. Excellent results, a good alignment. Why to go for a robotic?